everyone, we're going to talk to you today about amalgam fillings, metal fillings, silver fillings, whatever you want to call them, and why we don't place them in our practice.
So amalgam fillings have been around for decades, I don't know how long. It's what I first learned really to place a filling, and most patients out there, if you've had a filling in your lifetime, there's a good chance that you've had an amalgam filling. Why don't we place them in our practice? The issues with amalgam is that it doesn't bond to the tooth or seal the tooth. So if you have a hole in your tooth, a cavity, and then you are then restoring it with a filling, the amalgam just sits in the hole. It doesn't seal the tooth and it doesn't bond the two sides of the tooth back together again. Also, it sort of expands and contracts with temperature, and that and the fact that it doesn't connect the sides of the tooth together again mean that you often find cracks under amalgams. In almost every amalgam filling that I remove, if that amalgam filling is wide or deep, I almost always will find decay that's crept in underneath, and also cracks that have developed beneath the remaining bits of the tooth. So that's what I commonly find. You often don't have symptoms straight away, but eventually in the lifetime of that tooth, it's not going to last forever. So that's why I place a composite instead of an amalgam filling. Some people are sceptical about composites and as to whether they last as long as an amalgam. And I suppose it's an interesting question. So often with an amalgam filling, it's not the amalgam filling that fails, it's the tooth that fails around it. So the filling might last a long time, but the tooth is not going to be strong around it. And composites, they have the potential to be a really good restoration, but they are very technique sensitive. So you need to have the correct conditions, you need to have moisture isolation, you need to place them in the correct way, and it's a material that behaves differently. So they will work well if your dentist who's placing them takes the time and care and has the knowledge to place them. And so again, I suppose in an NHS practice, when you're under more time pressures, it's difficult to place composite restorations and to get them to last well.
I mean, for large composite fillings, you can have an hour blocked out for that procedure, couldn't you?
Easily.
Yeah.